This PowerPoint is about hospital organization and performance. My name is Elaine Edwards. I'm a student at Aspen University, taking Nursing 502 Healthcare Systems. The objectives of this PowerPoint will describe the hospital governing bodies and administrators' goals, examine stress and tension between physicians and hospital administration, describe the leapfrog results and their influence on patients, and finally discuss patient advantages and disadvantages of having treatments at a standalone run physician clinic. Agenda. Topic 1. What factors contribute to the tension that usually exists among hospital governance, medical staff, board of trustees, and hospital administrators? How can they exist harmoniously? Topic 2. What is the public's readiness in utilizing Leapfrog Group, a survey tool, to access hospital information when choosing medical care? And topic 3. What are the advantages and disadvantages for patient or physicians' entrepreneurial initiatives with opening freestanding diagnostic and treatment centers and specialty hospitals? What financial challenge is this to hospitals? This slide depicts a possible hospital meeting between physicians and hospital administrators as they sit around the table collaborating. They look pretty cordial. And that's what this topic is about, is what factors contribute to the tension among hospital governance, medical staff, board of trustees, and the administration. Here we see a brief synopsis of the role of the hospital trustees, the hospital CEO, and the physician. This is just a few of their managerial duties, and is just a brief synopsis of each. The hospital trustees recruit, supervise, retain, evaluate, and compensate the manager, which is the hospital CEO and physicians. They provide directions for the entire organization. They establish a policy-based governance system, govern the organization and the relationship with the CEO. So the hospital trustees and the hospital CEO have a closer relationship than the physicians and the trustees. The hospital CEO ensures patient safety, maintains financial solvency, promotes healthcare quality, strategic plans to discuss the future goals and objectives for the hospital, which this information is provided to the physicians in collaboration. They develop revised policies and procedures using evidence-based practice, usually also in collaboration with physicians. And they ensure organizational compliance with various regulatory laws such as CMS, Medicare, and other agencies. The physicians are responsible to the Board of Trustees, governance structure, hospital administration and patients, including nurses, provides medical knowledge and institutes appropriate policies and procedures. They maintain medical expertise to diagnose and treat patients, perform utilization review, and a strict knowledge of the reimbursement system is also required. This slide describes the conflict between physicians and administrators, as you can see here. And it's usually, sometimes they feel like it's a us versus them scenario. And they do have a for lack of a better term, a love-hate relationship. And it feels like us versus them sometimes, the physicians have told me. The physicians work long hours, and many have no work-life balance. They have increased administrative duties, they have less patient contact time, and because they have the electronic health records requirements for insurance billing, all this ends up being sometimes an effort reward imbalance. So they feel like they're not being rewarded for all the time and effort that they put in. And then there's the dreaded medical school debt. On the other hand, the hospital administration is legally responsible for everything that happens in the hospital. They help establish policies and make difficult and strategic decisions and oversee the organization's activity, all while trying to build community relationships. And finally, and probably the most important, is the financial controls that ensure that funds are prudently invested, they manage the cash flow and the contracting parameters, the policies related to budgets, and which is why physicians are always at odds with the hospital administration, because some of these things that under the financial controls do not in line with the physician's goals. I inserted this slide here because it's a great way to begin conflict resolution. And the way to get started is to quit talking and begin doing. Conflict is often about how you do and not what you do. Meaningful engagement with each other is one way to start effective conflict resolution. All parties have to respect the organization, the management, clinician, and all of its employees as well as the stakeholders. Decrease aspects of the system that steal time and touch from the doctor-patient relationship. This goes back to the previous slide. We talked about everything the doctors are responsible for in their daily tasks. Every effort has to be made to eliminate administrative requirements which serve no clinical purpose. One physician I spoke to stated that an admission requirement that contains post-payment verification of what was done or prevention of unnecessary service through prior authorization, that they believe physician orders already covers it. But because of the fragmented insurance reimbursement system and the documentation through electronic health records that it requires is too time consuming. One author stated that for every hour he spends with the patient, he spends 2 to 2.5 hours charting about it. This can definitely be time consuming and interfere with their work-life balance and cause burnout. This causes stress, and one article stated that the number is as high as 50% of doctors being stressed out about electronic health records, insurance reimbursement, and documentation. For this reason, the physician wellness committees are a very important aspect that hospitals should adhere to assess for physician burnout and collaboration with doctors. A single-payer insurance system would alleviate a lot of the stress and burnout on doctors. However, as of yet, there isn't anything that the hospital administrators can do about that, so their backs are really up against the wall. Lack of autonomy is another reason why doctors have opened up their own surgery centers, diagnostic treatment centers, and cancer centers. This particular behavior wreaks havoc on the bottom line of the hospital because they lose revenue when services are not performed in the hospital. But still, continuous political involvement to change insurance reimbursement make it less cumbersome, and it needs to be related to the legislators at the government level if possible. The second topic describes the leapfrog group. The Leapfrog Group has been in existence for more than 20 years. It collects, analyzes, and publishes data on patient safety and quality care. It also assists patients with informed healthcare decisions and encourages other choices. It fosters better care in saving lives, and they have parameters that are predicated on the latest science, which is usually evidence-based practice science, from the scientific advisors at the Armstrong Institute for Johns Hopkins Medicine. The Leapfrog Group is proud because they build a movement for transparency, so they remove all the curtains and the walls so the patient can see exactly what's going on in the hospital through the survey information published on their website. As you can see here, the Leapfrog Group has a yay or nay mentality. It helps the patients choose a safer hospital, find the right one for them, and protects the patient while they're hospitalized. They actually have a whole list of things that the patient can do when they're hospitalized and questions to ask so they understand exactly what's going on. Here we're going to discuss the financial challenges of a hospital. Patient or physician dissatisfaction can be associated with increased risk of major medical errors. Doctor burnout doubles the risk of an adverse patient safety incidences and worsens patient outcomes. Patient satisfaction scores are low, and patients are less likely to seek care within certain hospitals because of the information that can be obtained in the Leapfrog Group. Reimbursements are low, and that all equals loss of revenue. This is the reason why hospitals cringe when physicians open up their own surgery centers or treatment clinics. It's been reported that these services represent a significant amount and sometimes half of the hospital profit. Profit is lost when they work outside the hospital and not within it. The reason for this, though, is because of the reimbursement model that some hospitals pay physicians, and they feel like they can do better independently and not have the hospital administration breathing down their backs about administrative duties. Some physicians feel it gives them more autonomy and enables them to work and spend more time with their patients. They also report a better work-life balance because they're not on call. So they're in control of their schedule and not the hospital administrators. One study suggests that the physician's salary is a major part of the hospital budget. It's been reported that physician's salary has become the fastest growing expense in many hospitals, and this forces the administrators to cut expenses in other areas because the administrators are ultimately responsible for the budget control and bottom line expenditures. If a hospital wants to hire the best neurosurgeon or cardiologist, this is going to come at a steep price, and some services may be cut as a result of that. Some hospitals even report an excess of $200,000 loss per hospital employed physicians, and that can definitely affect your bottom line. And this all equals loss of revenue. In summary, physicians are the cornerstone of the hospital. Hospital administrators and governing bodies must be sensitive to the needs of each other and the physician when designing strategies to run a hospital. They must keep the doors open for communication, that's for sure. Patient safety and specific quality measures that enhance the quality of care and influence positive patient outcomes and satisfaction are benchmarks that are monitored by the Leapfrog Group. These findings are made public so that stakeholders have easy access to this information when deciding on where they're going to go for their care and which doctors they're going to see. Hospitals are continuously facing financial challenges. Physicians seeking more autonomy and increased work-life balance are establishing standalone surgery centers, cancer centers, and clinics. Hospital administrators must be creative when designing services to offset revenue loss with physician entrepreneurial independence. Thank you for viewing this presentation. I hope it was informational and enjoyable. And just remember, life begins at the end of your comfort zone. These are the references that were included in this PowerPoint presentation.